Hello friends, in this video, we are going to deep dive into aphasia. Imagine waking one day, unable to express what you are thinking, not finding the right words to express yourself, or finding it difficult to understand what somebody is telling to you, finding it difficult to understand what the individual standing in front of you is trying to tell to you. Conversations becomes difficult despite hearing every word clearly. Aphasia isn't just one size fit all condition. In this video, we are going to discuss and understand some of the important and overlooked variations of aphasia that impact individuals in their real life. We are going to discover the hidden complexity that you need to understand to work on your aphasia better. So if you are someone who is suffering from aphasia, or your family member or loved one is suffering from aphasia, then this video is definitely a very interesting video for you. Let's get started. So let's dive deep into the classification of aphasia, but beyond the textbook kind of definitions. Let's understand at a human level. Aphasia are of different kinds. First is global aphasia. The second type is transcortical aphasia, which combines motor and sensory aphasia. Third is conduction aphasia. And fourth is anomic aphasia. When a person suffers from global aphasia, the most severest form of aphasia, an individual not only experiences difficulty in speaking, but understanding, reading, and writing equally are difficult for them. Communication is just the biggest challenge, not only for the individual, but for family members as well. Because there's no understanding, there is no comprehension, there's no ability to communicate. This gets frustrating as the individual is finding it very difficult to work towards it. Sometimes it leads to depression and other mental health issues as well. And sometimes it can get so worse that patient starts doing self-harm. In a transcortical aphasia, where your motor and sensory areas of the brain are involved, which is similar to Broca's or Wernicke's aphasia, where the patient finds it difficult to understand and to speak out, but the repetition is preserved. So what happens is, the patient won't be able to think and respond back to the right questions. He or she will face difficulty in explaining, in finding the right words, in comprehending what you are trying to say. The speech production will become effortful and broken. Even though the individual will be able to understand what you're trying to say, complex instruction following is a very big challenge for them. Of error will be there, but correction of the error will be difficult. This leads to frustration and depression. The next type of aphasia will be conduction aphasia, where the person will be able to understand, will be able to respond back, but repetition will be a problem due to disrupt connections between different brain areas. When it comes to anomic aphasia, even though the patient knows what to speak, finding the right words is the challenge. Speech will be fluent, but will be not to the point. Keywords will be missing here. So why all of these challenges happen? Now, there are several reasons to that. One is the pathology of the condition itself, where stroke or any other health condition which relates to the brain damage will be involved. But apart from that, there are some other errors or problems or impairments that develop in the brain, where the first one here is the lesion in the brain and the disconnect of that area of the brain with other brain areas which are responsible to work together. For example, in aphasia, it's not just the single brain damage area, but when the brain damage will happen, the area will lose its connection with other parts of the brain. The neurons gets disconnected between two different brain areas, which leads to conduction, which will cause these language problems. Next, there will be loss of brain plasticity, and premorbid ability will be impacting the recovery. For example, everyone's brain adapts differently. An individual's previous ability, previous language skills, education, brain flexibility will definitely impact how severely and how easily a person can recover from aphasia. For example, someone who was very active before stroke, someone who was well educated before stroke, someone who used to keep the brain very much engaged, who was multilingual, for them the impairments will be less compared to someone who was sedentary, who was not involving brain much in their day-to-day life, who was knowing limited languages. For them, the aphasia gets more challenging. Similarly, the mental health not only of an individual impacts the recovery, but the environment around which the patient is living also will impact the mindset of family members, caregivers, the motivation of family members and caregivers. their effort to help the patient recover from the condition. All matters. So, what's the recovery scope here? Well, apart from the basic speech therapy and the regular therapies, there's a lot of research and development happening in this space, which helps these individuals to overcome these challenges. Some of that I would like to highlight here is there are advanced neuroimaging techniques that are coming up that helps clinicians, doctors, speech language therapists, physiotherapists to identify exact lesions and the disconnect that these lesions give to other areas of the brain. Modern brain scans like functional MRI and diffuser tensor imaging are helping researchers see how language network works in real time. It also helps researchers understand that how different brain areas work in sync and coordination with each other, and how the sync loss impacts the communication abilities, which improves the diagnosis, at the same time the treatment procedures. The next is emerging therapies which are beyond speech therapy. Speech therapy is the critical component when it comes to aphasia management, but there are a lot of other therapies that are now developing. When it comes to physical rehabilitation, oromotor rehabilitation are very critical aspects, because when a patient suffers from stroke, there is a certain aspect of facial paralysis that will also happen. This facial paralysis will lead to lack of muscle strength, lack of muscle coordination, which is very critical when it comes to speech production. Along with that, there are some advanced rehab tools that are coming up with the help of technology. Transcranial magnetic stimulation, AI-based, device-based therapies are under research that will be helping patients with aphasia in future, are helping currently as well. AI tools and machine learning tools are being heavily developed these days, which can analyze patient data, create treatment plans according to patient data, improving the accuracy of assessments, at the same time rehabilitation, which makes the rehab process much more adaptive based on individual needs. So this is what is about the advancement. But let's leave this video or end this video with some practical tips that you can start implementing on the day-to-day basis to improve your aphasia related challenges. Number 1, use of simple language techniques. When I say that, starting from simple sound production to progressing towards words and then towards sentences. This can be done in day-to-day life with the help of caregiver and patient altogether. A daily commitment of 1 hour just in practicing communication skill is more than enough. Giving extra time to respond to an individual who is suffering from aphasia. People who are around patients who suffer from aphasia needs to be empathetic. Needs to understand that for them it's going to be difficult to retrieve words. It's going to be difficult to understand what you are saying. It would be difficult for them to find that right words. So be patient with them and give them that adequate time that they need to communicate. Don't show your frustrations to them. In fact, encourage them and be there with them when they feel frustrated. Use multiple modes of communication. Don't rely just on verbal communication. Communication can be done through expressions, can be done through hand gestures, can be done through body language, can be done through flashcards. There are many more methods. Find which one works best for an individual who is suffering from aphasia and help them develop that first. The next is confirm understanding. Try to develop this habit of reinsuring what they are trying to say. Get their approvals. This will improve their confidence levels. They will be getting much more better in their communication. And last but not the least is encourage participation. Patient will be very much demotivated at this time. They would like to isolate themselves. But despite isolating, encourage them to get involved in small things, small chores that an individual does in their day-to-day life. Include them in conversation. Include them in decision making, which will help them to maintain their confidence and independence. Patience is the key, and patience is precious here. So make sure never lose your patience. Always believe that there's going to be a day where things will get better. Be faithful, be hopeful, and trust the process. I would like to end this video with this important message for all of the individuals who are suffering from aphasia and the people who are caring for patients with aphasia. Recovery is a journey. Every small step matters. There are advances happening in the technology, and all of this is happening for good. And these things will come in your hands, and you would be able to take advantage of these and would be able to help your loved one. So make sure to stay informed, advocate for resources, encourage research, Participate in the research if you can, and become key partners in the progress of your loved ones. I hope these words were encouraging for you. On that note, I'll end this video here and I'll see you in another video. Thank you.